Hey everybody, how you doing? Sean Majumder here. The date is Monday, April 6th, year of somebody's Lord 2020. And just a quick note, I have decided, that's my wife, by the way, she's playing with our baby. If you hear any kind of yelling and squealing and singing in the background, my wife is an amazing mom. And Mattis loves being sung to. It's fabulous. And speaking of Mattis, and speaking of my beautiful wife, Shelby Fenner, I just wanted to let everybody know I'm going to be migrating all of the episodes that we've done so far. Not been many, only 7, from the movie womb, which we've enjoyed and we love. But, you know, when I started doing this one called It's Pronounced Majumder, I just thought, you know what? Keep it simple. Just keep it all in one place. And so that's what we're doing. We're going to get rid of the movie womb. Shutting her down. It was a good start. It was my little foray into it, but this is going to be way easier. I got it. I'm right here. I'm good. It's pronounced Majumder. It's simple, and this makes it nice and clean. You know, I can talk about having a kid here. I can talk about being a parent. Shelby and I can have chats on here, just all in one place. I think it's going to be better. Plus, you know, it's my name. I can talk about comedy. It just gives me more flexibility, and I think it's a good choice. And I wonder if you'll agree with me. Now, if you're just being introduced to my podcast, It's Pronounced Majumder, please go and listen to all the ones that we've got. It's only 7 episodes, but they're really, really good, I think. You know, they're myself and Shelby and her mom and different people talking about having her kid. And it is really interesting, you know, because we're not it's not like a parenting chat. It's more about the experience of having a kid and what it's like, and, you know, having a brand new baby. I mean, our baby's now 7.5 months old, so it's really fresh. She still smells fresh. There's a lot to talk about. So please, if you enjoy this, I would really love it, because you're going to get a lot more now because we're in isolation. And I'm loving this podcast thing. So please subscribe to It's Pronounced Majumder. Hopefully it's on Apple. We've just kind of like done a thing out there, put it out to all the Apple, to the Spotify's, the Pandora's, the you know, all of it, iTunes, everybody. And so hopefully they'll come back and say, hey, you've been approved. I feel like I'm applying for a loan or something. But anyway, thank you for listening to It's Pronounced Majumder. And I just wanted to let everybody know, if you've been listening to the movie womb, I've gotten rid of the movie womb. All those episodes are now over here. Big thank you to Buzzsprout. I really like these guys. They've been really good. I've quick emails. You know, I sent them an email, asked them how we can do that. The response was really strong. They came back quickly. Addie, her name's Addie. I assume it's a girl, or they. I don't know. However you self-identify. But either way, Movie Womb is now here. It's all pronounced Majumder, and that's it. So thank you for listening, and thank you for tuning in. And we are in the middle of a pandemic. For those of you listening 5 years from now, we are in the middle of a global COVID-19 pandemic. Shit's getting real now. I mean, it's really starting to ramp up. Everybody's out there trying to eat chlorine pills because of Donald Trump. I don't know. So people going out trying to get malaria and then get them a prescription. It's backwards. It's backwards. You shouldn't be doing that, people. Stop it. But anyway, it's kind of crazy times. And right now, I just wanted to talk a little bit about and introduce you to the next episode on It's Pronounced Majumder. I've already recorded this. It was my neighbor Dan, Dr. Dan. He's an amazing guy. Him and his wife, Kelsey, they live next door. They are both doctors. They are both phenomenal doctors. Right now, in the world we're living in, they are our frontline heroes. And, you know, having a neighbor who's a brain surgeon and also now tasked with kind of implementing the rules and regulations and the systems of how to deal with COVID. He was very insightful. He was able to give me a lot of information. We talked a lot about some cool stuff inside baseball, about what people on the front lines are going through right now. You've seen it on the news, but this chat, it's not really a medical chat. It's more, he's my neighbor, and he's kind of giving me some really important insight into what's going on. And I was going to wait a week before I put this out, but I thought, no, you know what? Right now, I just did an Instagram video to say thank you to all of the Newfoundland and Labrador healthcare professionals. They're doing a really important campaign to, it's good to get everybody on board, thanking them, cheering them on. We have no idea, unless you're inside and you're going through what they're going through, sleepless nights, the fear of getting it and bringing it home to your family. There are so many levels to what's going on right now that it's good that you don't know, because you're at home, and stay home. Please stay home. That was my biggest takeaway from my chat with Dan, was the staying at home isn't just something to say, hey, it'd be in your best interest to stay home so you don't catch it. It's actually not that. It's actually the opposite. He said the fact, and all those signs that we see of our frontline workers on Facebook and, in the photos of saying, you stay home so that I can go to work, it really makes a difference. He said it buys them time. It buys them space. It gives them an opportunity to do what they do best and what they're trained to do, and for them to adjust on the fly, because we are doing our civil duty really right now. We need to be unified. We all need to be listening and staying at home. And it even took me a little bit. I was like, baby, I want to go surfing. Where else can I social distance better than in the ocean by myself? That's all surfers want to do. Stay away from people. But it's not about that. It's about staying at home, keeping the roads, keeping everything open, keeping it at home. So that's we talked a lot about that. We talked about the procedures. He gave me some ideas around timelines, about what he expects here in Los Angeles. It's all very insightful. But he also said, we just don't know. We just don't know. So I wanted to just say again, thank you for listening to the Movie Womb. Movie Womb is now over here. We are only one podcast. It's called It's Pronounced Majumder. Please subscribe. Please follow along. I'm going to be trying to do as many podcasts as I can. I really love this. And, thank you for listening. And I wanted to introduce you now to the second episode, technically, of It's Pronounced Majumder. This is Dr. Daniel Donoho, my neighbor, brain surgeon, cool dude, amazing husband to Kelsey, who is also a frontline soldier, pediatric emerge doc. He gives us the exact title, but she basically saves babies' lives. That's what she does. So she is a rock star. All right, enjoy. Hey, everybody. Whoa, that was loud. I yelled it. Hey, everybody. Interesting times. It's pronounced Majumder, by the way. For anybody who's wondering, it's pronounced Majumder. Have fun with it. Do what you will. I ain't judging you. Guys, I'm stoked about today because just to give you a little insight, I live in Los Angeles, California, and as you know, it's on lockdown. Everybody's staying away from each other, and it's scary times. And in these scary times, you want to have knowledge. So much fake news. There's so many people out there spinning theories, conspiracy theories, and this and that, and all the rest. And I don't know who to trust about things. And I am so lucky because in my neighborhood,
I think there's 2 or 3 houses that are doctors. And my direct neighbor just over here is a doctor. Not only is he a doctor, he's a doctor, and his wife is a doctor. And because we just had this beautiful baby, Mattis Maple Majumder, we found out that his wife, Kelsey, is like a pediatric emerge doctor. She's in the NICU. She saves babies' lives. And the other doctor, his name is Dan, and his last name is, I'm going to get him to pronounce it properly because I always mess it up. I think it's Daniel Donoho, Danny Doe, D-Dots, the D-Biz, Donoho. Anyway, he know, okay? He know all. And he is a brain surgeon. So he is an amazing dude, and he's a great neighbor. And I'm really looking forward to talking to him right now because with COVID and everything that's going on in the world, there's just so much fake news out there. And I thought, I saw him this morning, and he just came back from work, and he comes out of his car, and he's like, it's a crazy world. We're living in crazy times, man. And nobody's really, there's people talking to the doctors on the news. You see them talking about they don't have any masks, they don't have any this, they don't have any that. But Daniel, Dr. D, is the man who actually teaches a lot of the doctors about what needs to happen in terms of this new world we live in terms of the response, how to manage things. Whatever. I'm a comedian. I'm an actor. I don't know any of this, but he knows, and I'm going to text him right now just to see if he's ready. He's a great resource for information and a wicked guy, too. Just doing an intro. You ready to chat, sir? That's the sound of a thing going through. Now, I don't know if I can FaceTime him. I didn't download the Zoom. He said everybody's using... I didn't do the Zoom thing. He said everybody at the hospital is using Zoom. Everybody's freaking out about Zoom, I guess. But he said the audio's not great, but that's fine. Phone calls on this baby work really well. And if I can screen record the things, which I'm going to start recording now on my device. As you may have seen already, if you've seen the episode about the Tiger King with Corey Gibson, we were able to work on that and do a little FaceTime action. And screen record, and that was pretty cool. So we're doing that right now. I'm waiting to hear back from Dr. D. And listen, I'm not coming at it from a journalism perspective. I'm coming at it from purely a human citizen perspective. But this is how intense it is right now. And, sometimes I'm a little casual about things, but I don't think I'm that casual. We have a doctor next door who has great knowledge of what's happening in the world, but, when it comes to COVID. But these things change all the time. I want to ask him about, for a while it was just like, it can only be transmitted via touching surfaces. Don't touch your face, wash your hands. Then it was like, no, it's droplets. Droplets, you can get it from droplets if you're 6 feet away. Now we're hearing it kind of floats around and stays in the air for a little longer. So I invited him over, and I was going to say, okay, Daniel, you go out in the courtyard, wear a mask. But upon speaking with Shelby, we realized it might not be a good idea to bring any human inside of our 14-day quarantined house at this moment. I'm gonna start FaceTime. I'm gonna see if he's available on the old FaceTime. We'll see if it works. Just so you know, I'm using this as a moment to help me edit.
You guys can hear that? That's the phone ringing. The new kind of phone ringing. Okay, maybe he won't be able to FaceTime. I don't know what kind of device he has. Do doctors use Blackberries? I think doctors use Blackberries. I'll try them again in a bit. But my thoughts today are, what's going on inside the walls of these hospitals? What's going on? What's really going on? Not the shortages. Yes, there's shortages. But what are these doctors saying to each other? How fearful are they of what's happening in the world? Oh, look at that. He's FaceTiming me back. He's FaceTiming me back. Screen recording. I'm gonna start recording. Here he is. There he is. You can't see him, but I can see him.
Hey guys.
Dr. D.
How you doing?
It's Dr. Oh, it's not connected on the old Bluetooth. Hold on now. I can hear you there, but I can't hear you. Same thing. It's a weird thing with the FaceTime thing. Sometimes it actually, Roadcaster Pro, disconnect. I'm going to reconnect, sir. Roadcaster Pro on the Bluetooth. There you go. Go ahead and say something there, Dan.
Hey, how you doing? It's Dan Donoho.
Dan Donoho, not Don. I don't know. Dan, I don't know, because I was trying to get it exactly right before. I've started the pod. We're recording that right now, by the way.
Awesome.
But I was saying how I was trying to get it exactly right, but it's Donoho.
That's how some people say it. That's how I say it. You can't really get it wrong.
Yeah. Coming back to you on the video now. Donoho. It's Donoho.
Yeah.
Okay.
Yeah, that's right.
And where's that from? What country is that from, if you don't mind me asking? Or is that a racist thing to say now? Because my last name is Majumder, so everybody asks, what the hell are you?
Yeah. So I don't know.
Come on.
The story is that it's actually a Native American origin name. And what happened was, so apparently some Native American sort of horse thief type somewhere in southern Oklahoma, Red River kind of area, sort of tried to cross the border into Texas and assume a new identity in an Irish community, and couldn't spell very well. So this is what we've ended up with. Then again, my great grandfather was actually, known to tell some tall tales from time to time. So we're not really too sure.
That's an amazing story, though. I want to see that Disney movie. That should be on Disney Plus. That guy.
Yeah.
I just love it. You know, he kind of has a bit of a complexion. He's really good in the woods. He can hunt and fish, and he's walking around going, "Ooh, how are you, everybody? How's everybody doing?" It's like, wait a minute, where'd you get that accent?
Yeah, I don't know if it really worked out for him, but
well,
yeah.
You know what? All the family tree stuff aside, you are my neighbor, probably on that side of the house, without a doubt, my favorite neighbor.
I'm honored.
It's a great.
It means a lot to me.
It's a great. We have a good little neighborhood here, generally speaking, right?
Yeah, except for the coyotes and the home invasions, it's pretty good.
Yeah,
it's a good place to live.
There's a couple, for those of you who weren't in the neighborhood whenever that was, Spike Jonze, director extraordinaire, who lives not far down the road, got his house broken into. He had a home invasion. That was in the evening. Earlier in the day, there was another guy who had two dudes break into his house while he was working out on a treadmill. That was a real bad one. I think the Spike Jonze one was pretty, if you can call a home invasion, chill. That one was chill compared to what the other guy went through, which is rare. We don't live in the hood. We don't live in like a bad part of LA, do we? So,
or do we? I mean,
point taken. Coyotes, cougars, home invasions. This place sucks. You'd never see that on this stage.
Yeah, if any of the home invaders are listening, listen, I promise. We've already been cleaned out. Okay, we've got nothing left to give.
Oh, man.
Do not come here.
Yeah. I mean, you have a very large German Shepherd. I have a Boston Terrier that sounds vicious at times. But Max is your German Shepherd, and I have 2 Boston Terriers. They were kind of feisty back in the day, but now it's not so much.
Yeah. Well, they're still fearsome on the inside.
Yeah, exactly. So. Listen, you are in the heat of it right now, man. How you feeling? This is so. Why don't you tell people who are listening exactly what you do? What is your trade? What courses did you take in school to get you to where you got to?
Yeah, so I'm currently a neurosurgery chief resident in Los Angeles at LA County Hospital. That's really the endpoint of 15 years. It's going to be of training. Starting in college and did a couple of years of research and 4 years of medical school and 7 years of residency training here. So, it's been a long road, and now we get to ride off into the sunset of the pandemic. So, it's been a good run, and what we got.
You made it.
Yeah. I mean, it ended, right? Right. It will end.
It will all end apparently soon, according to the news. Yeah. Oh my God, dude.
Yeah.
It's a crazy time we're living in, and your beautiful, amazing wife is also in the same field that you are. What is she exactly? What is her exact title, Kelsey?
Yeah, so she's currently a fellow in neonatal perinatal medicine, which basically means she's an ICU doctor for babies.
Gotcha. Which is good for us. That's why we had the baby, by the way, because we knew that she was that, and just in case, we just knew, she's go-to. I
mean, it certainly, it makes planning a lot easier. Sometimes you can just bring the ICU to you.
That's right. And having you as a brain surgeon next door, I'm going to get a little bit riskier now. I'm going to just have some fun with it and see what happens. Yeah. But so you guys now you're both actively working. I know that she's not quite right now because are you able to tell us that you are pregnant? Is that should I even say that?
Yeah, we're in mid-second trimester, and it's something that we're really excited about and nervous and terrified and all the normal things now with this overlay of how does it feel to have how does it feel to have a pregnancy in a pandemic? Like we did not plan on this.
No, of course, of course. And it's funny because Shelby
the pandemic part, the baby we're like super psyched about.
Yeah. and so it was funny because Shelby and I were sitting downstairs. We were obviously in isolation. We were taking it easy, and we started talking about you guys, and we were just like, she must be so nervous. Like Shelby said to me, she goes, they must be so nervous being doctors right now when the pandemic's hitting. So I text her and I said, hey, how you guys feeling? How's everything going? I mean, you guys are working. This is about a week and a half, 2 weeks ago. And she said, yes, we're really nervous. We're really, and she said, I don't know if Dan told you, but I'm also pregnant. And I was like, oh my God, how much more anxiety does one need? And so how are you guys doing? How is your mental state? I'm not sure. Obviously, you're not a respiratory doctor, but you're in it. How's it going? How's your mental state? I'm not coming at it from a journalism point of view. I'm coming at it from a human citizen point of view. Like how's it going?
I think sometimes it seems to me just kind of my friends having been pregnant and stuff, you get a lot of like weird fears as like a new mom or dad, and you're like not really sure if it's like you or if it's the world or if it's real. And they're real. And I think it is just real. Like, that fear that like you're going to have like a zombie apocalypse and like have to defend your family against like, a pandemic. Mm-hmm. That's like now it feels like that's what we're doing. Like it's been a totally crazy, totally wild ride, adding that layer in on top of everything. It heightens all of the, all of the risks that occur. And, I mean, even just like, leaving the house, like crazy. Again, it's going to sound like we live in a bad part of LA, but like leaving the house, crazy things happen. I was going in to do an emergency surgery one night a couple of weeks ago, and we got this message through, I think, Nextdoor that there was like an armed gang coming up the hill. And obviously you don't believe it, right? Because like, what are the odds? But then, like, I mean, it could be true, like,
Yeah.
and it's crazy. Like this day and age, like I would actually like. It wouldn't like totally blow me away. I wouldn't say there's like a 0% chance of that. I'd say there's like a 0.001% chance. It could be. Like anything could be.
Anything could be right now, and that feeling of like before. I'm a pretty optimistic guy. I'm a pretty realistic guy. I'm actually probably on the other side of. I'm like, oh, dude, no, that's not real. That would never happen. Are you still there, audio-wise? Your video kind of dropped out, but that's fine.
Yeah.
And so, I'm.
Do you want to? It might be easier for you. I was just thinking, do you want to switch to just audio?
Yeah, we
or
can
do you want to do the video? Because I think the video sometimes makes the audio worse. I'm just thinking about that.
Yeah, let's try that. Let's just switch to the old. Do you want me to call you right back?
Yeah, let's try to just do an audio call.
Try to do audio. Here we go.
Yeah, just on a straight up audio, and that way, number one stuff.
So it's probably less dropouts. He's absolutely right there. Okay, so let's go with just voice. We're gonna do the voice. Rodecaster Pro. It's happening. Donoho. Rodecaster Pro. Here it is.
Yo.
Better. I think so. Yeah, we're good.
I feel like it's just going to be like smoother,
Yeah, there won't be as many glitches for sure.
Yeah.
But armed gangs, asteroids hitting the Earth, global pandemic. It feels like it's getting worse. I mean, obviously, it's getting worse and worse every day. Naturally, that is what it seems like a pandemic does. But question mark? Like, I don't even know. I can't even process it. Now, we have a newborn. You have a born coming. And and as doctors and surgeons, I don't know, man. I wonder about, there's anxiety. How do you manage your anxiety, even just as a surgeon? Do you feel more, when you're working, you have more things under control, you're grounded, you can't panic, you can't get into hot situations, you got to everything together. But does the pandemic throw a little bit like what does it do to the anxiety of you while you're at work?
Yeah, so my job has actually evolved a lot over the last month. So, about a month ago, I kind of just sat down and I was like, this seems like this is going to be a thing. Like, I should just make sure, like, brain surgery is important, but helping our facility kind of make sure that we're as prepared as we could be, kind of matters. And I think, the place that I work is great for a lot of reasons, but like all hospitals, it moves slowly, and it's on the time scale of, a global pandemic. It moves on the time scale of its own operations. And so, we just wanted to kind of try to get a jump start on this. And so we started with some planning and some training. And, now I spend more of my time most of the day actually working on these kinds of problems, that I do on actually doing brain surgery. I mean, because we're not operating that much anymore, because we're really only doing, sort of the absolute emergency cases. Anything, like if your brain tumor is growing slowly, we're going to let you wait.
Right. Let you wait.
Which is a crazy thing to say, right? Like we aren't talking about the contradictions of this disease, right? Like at the county, I take care of this incredibly underserved, undertreated, really vulnerable patient population. And I'm really proud to work with them, right? And now it's these same people that I have to call up on the phone and say, sorry, sir, your brain tumor is not growing fast enough. We can't consider it an emergency. So we're going to have to ratchet you back and have you wait a month or two, So we're the ones doing the underserving and undertreating. And it doesn't feel very good.
Yeah. And it's not, it's from a numbers perspective, Is that just what has to happen?
Yeah, I mean, I think we don't know, and I think we're still lucky in California, that the fear of the disease really is as bad as the virus itself, kind of at this point.
Mm-hmm.
Um, and I don't think I think I put something on Twitter now almost a month ago, so I don't know if it's withstood the test of time or not, but it said you're either gonna react too much and too soon, and people will say you're crazy, or you're gonna react too late, and you'll always wonder why you didn't do more. And those are just kind of that's it. Those are your only two options. Like, you don't know. If you knew what the right thing was to do, you'd do it. But there's so much uncertainty. You just have to decide what kind of mistake you're willing to make.
Right.
And we do this in medicine all the time. I'm very comfortable in medicine, making certain kinds of mistakes because I know what the circumstances are and what the odds are. And if I get a bad outcome, but I made the best decision that I could under the circumstances, there's only so much that I can control. And so I think it's one of those situations where we're trying to, really prevent certain kinds of errors. And frankly, we're accepting the possibility that we could be wrong about certain things. But it doesn't feel good. It never feels good to tell somebody with metastatic cancer to the brain, why don't we just wait 2 months? Like, you want to just get them in there today and just get it done,
Yeah. But the current time is very unique in terms of the beds that are required, I would imagine. I mean, I'm just getting this off of the news. Like, I don't know anything. And it seems like we're getting contradictory information. And I think, I was talking to you earlier about like the stuff, the plan that is in place constantly is changing. So how is that? Tell me about that on the front lines, like in the hospital. How is that kind of folding out amongst your peers?
Yeah, I mean, it's totally crazy times. And I think, the contradictions that we have to live through are absolutely mind-boggling. It starts from the beginning, right? It starts with testing, and we're saying, patients that come into the ER who aren't super sick, who aren't going to get admitted to the hospital, you maybe don't even need to get tested. Like, it's not going to, don't even come into the ER if you're not feeling symptoms. If you're not feeling short of breath, if you're not feeling sick, some of the guidances say. And yet at the same time, the doctors are clamoring and saying, we need to test everybody. We need every test. The contradictions of, when we look at this disease and we tell you, if you get this, there's a 95, or more % chance. If you look at everybody who we think may have this disease, that you're going to be fine. You may have, some bad malaise or a fever, this or that, but you're not going to need to go to the hospital. And at the same time, we're saying that the healthcare system is collapsing, right? And from something that 95% of people, don't even need to go to the hospital for. The scale of that is it's impossible to comprehend. And these are just some of the kind of the contradictions, that we have to just, we have to live through every day because we don't really know what's coming. How do you communicate about this? These are like impossible choices. How open should you be with your staff or with the public? And I think we always want to be as open, as we can. But that means sometimes we're giving people information that's out of date or incorrect. Or it was right until an hour ago. You know?
Like, what are the risks of, saying something? I mean, obviously the risks are high, but because everything is changing so fast, and, I assumed that you, being in the front lines, working as a doctor, you guys all meet 1 mile beneath the Earth's surface every week. You all know exactly. You're getting the updates way before everybody else. So you guys got it all laid out, like everything. But that's not the case, is it? It's constantly changing because, I mean, different research, it seems, even reports I'm reading online. In Iceland, there was a thing, I saw some report about the people that were there that they were testing have zero symptoms, but and that's not, is having zero symptoms the same as asymptomatic, or?
Yeah, so I think that this is like the hot question of at least last couple of days is, what's the deal with this asymptomatic transmission, meaning that you don't feel sick, and in principle asymptomatic means don't feel sick at all. You feel like this is just a regular day in April.
Yeah.
What's the chance that you're actually able to not just carry the virus or be immune to the virus, but actually be able to spread the virus to other people through droplets and secretions and that kind of stuff. And I think that the best answer is we don't know.
That's great.
I think we have to be comfortable making decisions amidst uncertainty.
Yeah.
And I think that people want a certain answer. They want to know the number. They want to know the outcome. Especially with what I do every day, we're very comfortable dealing in uncertainties and saying, I don't know the outcome, but I know the range of outcomes that could happen. And here's my priorities, and here's how I'm going to make that decision with the best information that I have. And if I'm being truthful with you, I don't know the problem. I can't tell you the percentage that the outcome is going to be a certain thing or not a certain thing. But I know that I've gotten all the information and I'm making the decision that's the best that I can. And that's really hard for people.
Yeah.
And
it's not a great PR campaign. You know what I mean? Like, it's not a great, information, when you think about the people who are, in charge of our respective countries of Canada and US and everywhere else, they're going out there, they're setting guidelines. They're saying, do exactly this list of 4 things. And people, I think they do those things and they go, I'm now foolproof because I'm doing what it was said on that little board. It said, do this, 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 and this. And I kind of fall for that a little bit, and Shelby, my wife, she's like, no, don't do it all. But then also, why take the chance? And she's actually a little clairvoyant. She's constantly like, nope, if you go outside, you have a chance of getting it. And then now we're seeing this whole, how long does it live in the air? I don't know. Your wife was explaining the difference between aerosolizing, or how do you pronounce that? When it's in the air, how big the droplets are, how, is it 6 feet or is it actually 8 feet? How long does it just linger in the air? Can I be walking through an area where somebody who had it was maybe asymptomatic or not, breathed, and I walk into it, it punches me in the face, and then 14 days later, I'm walking around like a zombie with no lungs.
Yeah,
that's exactly how it happens, by the way. But anyway,
well, you won't be walking around. That's the good news. You'll be sort of rolling on the street, foaming at the mouth as you turn into an undead. But no, I mean, the problem is that it's not black and white, and that a lot of our thinking in how we go about precautions and how we go about making these kinds of determinations makes it sound like it's either only one thing or only the other thing. And the reality is it's more like a distribution of possible outcomes. Like the vast majority of the time, you get droplets of a certain size, and under these certain rare conditions, some of which we encounter in the hospital frequently, it can be transmitted according to other conditions, which is why we take some different precautions in those situations. But I think this is where some of at least the beginning knowledge of the epidemiology, the study of the science of how this disease is spread between people, is really important, and that we kind of just have to use there's sort of these common sense things that they don't have to be black and white, but kind of everybody can understand them.
Yep.
Like if this was super easy to catch and everyone was always symptomatic, we would be seeing a very different disease. It would be showing up differently, because we have experience with diseases that are like crazy transmissible, that are like wildfire, right? Like measles is like the stereotype of this disease. Measles is insane. Measles is exactly what you're talking about. Like if you're not vaccinated and you walk into a room that someone with measles used to be in, you're going to get measles.
Are you serious?
Like
it's
if you're on an
transmissible
airplane with someone, it's insane, right?
Wow.
And there's different ways we can sort of model this and that. But just like if you're on an airplane with someone who has measles and you're not vaccinated, you're going to get measles. like better than 9 chances in 10.
So why isn't Trump using that as an example of saying, everybody just calm down? It's not the measles. Feels like Trump would use that as a thing.
It's funny. It's like I think I would. I've used this example a lot, and I've realized it's a really terrible example because it makes everybody start thinking that it is the thing. You know what I mean?
Yeah,
it's like saying like these two things are nothing alike at all, but you're even drawing the comparison, so it kind of shifts people's expectations towards the horrible thing that you were, So I think that's part of the deal, but I think it's just this contradiction that people don't, that's really hard for me as a person and for all of us as people to wrap their minds around this contradiction of, on an individual level, this may not be so bad, and yet this is the worst public health threat that we've ever seen in our lifetime.
Right. Because I do. I went to Mexico.
That's mind-blowing.
I went to Mexico. I went scuba diving. I had a cold. Shelby watched on the news as everybody was saying the U.S. was going to be closed. We immediately got on a plane. I didn't have any of those symptoms that, I was very confident, only because I had dripping it was very nasally. It wasn't in my chest. And I have asthma, and I was like, no, it's not there. I'm fine. But my mind was just popping off, but I was of the mind, I'm like, no, there's nothing. I got nothing. It's fine. It's fine. Then we get herded through customs. I'm like a cattle amongst hundreds and hundreds of people from all over the world funneling back into LA because they're about to close European flight. They're about to close European flights the next day. And I am feeling pretty relaxed, a little nervous, but there was this sense of, like you say, 95% of you, if you do have it, it's not that bad. You're going to recover. But we're seeing other things now. We're seeing younger. The biggest thing for me right now, which was interesting, was like, it's old people. Old people are going to die if they get it. But if you're young, you're fine. But now we're seeing all these young. My friend from Toronto, this guy named Nick Cordero has been sent to ICU. He's like, probably under 40, and he is just hanging on. He's unconscious. He's it's not a good day for him, and we're all praying for him. I don't really pray, but we're having positive thoughts for him. So let me ask you this: what has been the biggest surprise for you in observing? Whether it's reports from China or, because now they've had a bit of lead time to be able to put some more data together to come up with some more, ideas about what this thing actually is. What have been the biggest surprises for you? What you expected, or if you had any expectations, have there been any major surprises for you?
Yeah, so we actually in my little tiny corner of the ICU of the world, we actually had, I think, one of the, if not the first suspected cases of COVID-19 in America was actually in our ICU.
Really?
Almost almost 3 months ago at this point.
Mm-hmm.
So before this ever broke, it ended up not being the case. It was definitely negative, and it was another disease. But those first few days were really, really insightful of like, I wish I could have bottled up what we saw and what we learned from that and transmitted that. Just in like, it's so hard to go from, like, the best analogy I can give is it's like a peacetime hospital to a wartime hospital.
Wow.
I mean, we're, the nurses that I work with are absolute professionals, and they're phenomenal. But it requires a shift in mindset. I mean, here's an example, right? Like when we do this training, the first principle of all of the training that we do now is, the first principle is staff protection, right? Protect your staff, which means that everyone has an instinct, like if there's a cardiac arrest and like it's down the hall from you, right? Your first instinct is like, what can I do to help? Like, how can I get in that room? Like, what can I get them that they need? Like, what are the roles? Like, if I go by, I'm like, okay, cool. What's everyone doing? Does anyone need me to do anything, right? Does someone need a breathing tube put in? Do they need someone to run the code? Do they have people doing those things? Do they need somebody doing chest compressions? Okay, they're good. I'm on my way, right? But now the instinct is no, like you don't go in that room, right? The instinct is you put on your gear, right? You go in the proper way. And it's a profound shift in how we go about our daily life in the hospital. And it's not that we care any less about the patients, but it's just a really sobering realization that if one of us gets sick or goes down, and when that happens, because it will happen, we can really take a lot more people with us along the way. So it's a total shift in mindset and attitude. It's really hard to do.
Have you had to remind your fellow doctors at times? Because the human instinct, I mean, you swore to an oath, you took an oath, and now that's being tested. So have you had to kind of be like, hey guys, remember, or is everybody pretty, no matter how hard it is, they're on it. They're going against that instinct.
I mean, I think it's really, really hard to unlearn that. It's basically hardwired in all of us, and I think we do have to remind each other, and to check each other. And that's kind of one of the principles that we're teaching is, this buddy system for putting on and taking off protective equipment, right? And just like, it's no fault attitude. It's something we have in the operating room too. If somebody says, oh, you contaminated that, or, oh, watch out, you're about to touch your face, the response that you are trained to have, and it's not 100%, but it's what we're trained to have is thank you, right? Because that person, obviously in the operating room, they protected the patient by, preventing you from contaminating them. In this case, they actually protected you. So your buddy who was like, watch out, you're about to touch your face, it's annoying, and to get called out like that a little bit, but they're doing it because they're trying to save your life,
but do sometimes are there dickheads who sometimes do it to just, because there's personal shit going on? There's got to be some personal shit going on sometimes.
Oh my God. I remember this one nurse from when I was a medical student, the things you'll never forget is like 10 years ago, and I still remember there was one nurse at one particular institution that just took the absolute delight in like every tiny little possible thing you might have done that was wrong. This person was like, hey, you go leave the operating room and go, wash your hands again and re-scrub in because you just contaminated this or that. And you're like, well, I mean, I've been in a lot of cases like, you're seemingly every time I'm in this room with you, I contaminate something every 5 minutes, and yet in every other case I don't. And you're like, huh? But I mean, that's there's a lot of stories about medical training, but
that's human stuff. And I'm curious about that. Okay, here's a question: how long does it take to don the gear?
If you're pretty proficient at it, I think you could do it pretty well in between a minute to 2 minutes.
And what is the gear? Give me the list.
Sure. So this is not what a general person should wear in any way. This is for a patient who's in an intensive care unit on a breathing machine, who's actively like spewing out virus into a small contained room. You would wear at least an N95 mask. You'd wear a face shield. You'd wear usually some other kind of head covering. You'll wear some kind of covering for your clothing that varies between institutions. It could be a gown. It could be a full coverall. And you'll wear at least one pair of protective gloves, sometimes more depending on, what you're wearing. So that's kind of the main things is you got really good mouth and nose protection and eye protection, and then a solid barrier layer for any exposed surface or clothing. So
it's just like
that's the standard gear.
So it's just like going snowmobiling in Canada. The same amount of clothes you have to put on pretty much to go out. And it's the same, probably takes a little bit longer in Canada to put on all that gear. Balaclava, whatever it is. You just want to stay warm in Canada.
Yeah, exactly. Same deal. So it's the same kind of principle. No exposed skin, really at all for any of the gear. And then for some conditions you may use a full respirator hood that's sort of one of these sort of crazy sort of full helmety looking.
Have you had to have that? That's something I've seen Dustin Hoffman wear. I think he wore that in that movie.
Yeah, so they're kind of on that level. So I've worn sort of our version of that. We don't usually wear like the full contamination suit, and the reality about this is like it's not it's not like if you get one drop or one virus anywhere on your skin, you're automatically going to turn into a zombie.
Right.
You know, what the reason why we want to be so cautious is because it's just the law of averages. The probabilities add up.
Yeah.
And, you know, in healthcare, right, I can't socially distance. You know, my job is to go into the room. My job is to stand within 6 feet of somebody who's infected, and to do that potentially many, many times in a given day.
Right.
And so we have to make sure that the deck is kind of as stacked in our favor as it can be. So the chances are as low on any given day that we're going to get exposed.
And that's and that, you know, and again, you know, you talk about protecting each other and making sure your staff is safe. Have there been people getting it amongst your teams?
Yeah, so every single hospital and healthcare organization in the United States that I've ever heard of who has any patient with this disease has a staff member who's exposed. The numbers, I was just reading something from some of the Boston area hospitals, you know, are in the ballpark of more than 100 employees per hospital. I know those are big hospitals, but you know, that's an appreciable number of cases. So I don't think that that's necessarily our number at the county. I don't know our number, but I know plenty of people who have been exposed, and I know a few people who have tested positive.
Yeah.
And there've been a few doctors, you know, now who've died in New York. One of whom was a very, very highly regarded pediatric neurosurgeon, which is my subspecialty field. So I knew him from, from years ago from Interview Trail and conferences, and he was a very, very highly regarded guy.
What was his name?
You know, an emergency room, James Goodrich.
Rest in peace, James.
So
that's horrible.
Yeah.
And it was from complications from COVID.
Yeah.
So this thing is not, it's no laughing matter. I mean, you know, we talk a bit about, you know, how in neurosurgery and in some of the cases and situations that you personally have been in when you're as a surgeon, you need to use humor to kind of get yourself through some of the darkest things that human beings have to deal with. And, you know, I think I told you, you know, when I was working on this show called Detroit 187, I was working with these homicide detectives. They have to do the same thing. You know, they use humor. But this disease is not, you know, it's no laughing matter. Like people are, I mean, obviously many people are dying, but it's not just the cough. It's not just the fever. It's once it gets in there, why is it so different? Why is it so...
So here's the So
when it brings you to that,
that's absolutely.
Go ahead.
It's something that's totally different that we were never prepared for as doctors, as nurses, as EMTs. You know, this disease is fundamentally different, and here's the difference, right? We're pretty callous in terms of the risk that we'll take personally. You know, I've operated on, and I would happily operate on, you know, anybody with, you know, a lot of other infectious diseases, HIV, hepatitis B, hepatitis C. I operate on IV drug users. I operate on, you know, people who are, you know, just have these diseases for a lot of other reasons. And I don't consider that. Like, obviously I take precautions like any sane person. But it's not like I'm like, oh, I'm doing an HIV case today. You know, let me be worried about that. It's like, no, I assume everybody's the same, and I take the maximum precautions for every case. And that's what I signed up for. But this is different because this is the first time that you can get sick and you can bring something home to your family and they'll get sick. And this is the first time that people in the hospital feel like they're having to choose between taking care of their patients and serving that sort of higher calling versus keeping their family safe. No one's ever felt that before. No one's ever been through that. And so to get back to your question of why humor, like Black humor has totally failed us in this situation because we can't keep a critical distance from this disease, right? The reason why Black humor is so important is because it takes the horror that you're seeing of, you know, a young child with a horrible traumatic gunshot wound injury that you're desperately trying to save, you know, and it depersonalizes it and allows you to do what you need to do without having to every single second relive just what a horrible experience that is, because that would be paralyzing, you know. But we can't do that in this disease because that is the disease. The disease is affecting us. It is affecting our families, and that's not something that humor really equips you to deal with very well,
Yeah. Yeah,
because
you're
you
no
can't be personal. You
longer.
can't hold it at arm's length.
Yeah.
We're all in the same boat on this. Like,
That was
if
interesting.
anything, like,
Yeah, because I felt the same way when when we first when I text Kels, I honestly, your wife, I was like, oh, I think she's gonna have enough knowledge, and because she is such a highly trained professional in the medical field, she's gonna feel super grounded and have knowledge, and everything is gonna be, her response in her text is gonna be, no, we're good. You guys stay safe. She was like, no, dude, I'm nervous. Like, we're all scared. Like, it's all fucking crazy right now. And so I think that fear and anxiety is obviously everywhere, and it's having its effect on everybody in such a, everybody handles it differently. But yeah, this thing is very unique. And what's your prediction? Do you have any, based on data, based on numbers, based on patterns? Are you able to paint a picture yet in your mind, just for you and your family, and thinking about Los Angeles and being a citizen of the city, um, as to how, number one, California slash, I should say, LA slash California is going to come out of this, if they will come out of it? What kind of timeline do you think? Where do you think the U.S. is going to be in, say, 1 month to 3 months? And is this thing going to have a second wave?
yeah, I mean, I think I want to just really foreground this really carefully. I need to take off my hat as like any kind of official person or
Yeah.
where I work or what I do. This is just this is not my expertise, and
Yeah.
that's just I think that's important to say. And so here's what I've told what I tell people, what we do is we take this on a personal level. We take this very seriously, right? I'm not going to see my parents until we either have an antibody test that I can show I'm immune and not infected, or something really materially changes. I'm going to keep going to work every day, and that's something that I'm comfortable with. But we're going to take a lot of precautions. I'll clean my phone a couple of times, and when I get home, I don't wear my shoes in the house. Et cetera, et cetera. All of these just little things you can do to kind of stack the deck in your favor. And I think that everybody needs to follow the precautions and regulations that are laid out with really utmost seriousness, because this is something that's affecting all of us. And the reality is that we need to get out of this. We need to get out from underneath this crisis as quickly as possible. And the sooner that we're all, not just like compliant in the sense of like, oh, I have to listen to the man when he makes another rule, but in the sense of like, we have this World War II mentality of like, this is what I'm doing for our city. Like, this is what I'm doing for my family. Like, that's and I think it's important to explain what we're doing in healthcare too. Like, because of social distancing, we now have more than 100 new ventilators than we used to have a month ago, right? Because of social distancing, we have more training, we have more expertise, we have more medications, we have more, capabilities to do certain procedures and techniques than we used to have a month ago. So what you guys in the community have brought us is the ability to take better care of the community. And the more time that we get, the better we'll be when we inevitably have to deal with an increasing capacity, an increasing demand on our capacity. And it just takes time.
Yeah.
Like, it takes weeks and months. You can't make ventilators appear out of nowhere. You can't train people overnight. It doesn't. And when you get hit and you're not ready for it, that's when you see a really tragic scenario like we've seen in northern Italy, where they're having to do all of this stuff in the midst of a crisis.
Right.
And that just doesn't work. So, but to directly answer your question, because I avoided it until now.
No. But that was important to say, though. I think that was really important to say. And that sounds like, that was more with your Dr. Dan hat versus Citizen of the City hat. And so, as a person, what's your feeling about the future?
As a human, I'd say, like, get ready for this to be part of our lives in a very real way over the next 2 to 3 months. Whether we're going to see the full movement restrictions that we're seeing right now, I don't think so. But the reality is we're actually speaking, in my estimation, in LA, in perhaps the most pivotal week of the entire thing is actually right now. Because we're about 2 weeks since we started our social distancing. And we believe that we've done a very effective job at social distancing thus far, thank God. Because at my place, we haven't seen a massive influx of patients yet. So we at least know that we're behind New York. We used to think that we were about 7 to 8 days behind New York, but those 7 to 8 days have now come and gone. So it is possible that we have stretched things out longer. This week, we're going to start to see the first wave potentially of patients after social distancing started. So this week, if we can get through literally the next 7 days from now without a significant buildup in patients, then I think that we may have done enough that if we continue what we're doing, we can hold this thing at bay until we get better testing and, maybe even some treatment protocols set up. But if we start to see this week a beginning of a sustained on-ramp of patients, it's not going to be like 100 patients show up today and it goes from 0, but it's the way this works is it's 5, it's 10, 1 here, 2 there, and they just they just keep coming. So if we start to see that in over the next 7 days, then I think we're in for a long haul. So it's like somewhere in this week is like Groundhog Day is basically how I think about it. Right. Like if we get through a good solid week of no run up in cases, then I think everyone's going to start looking forward and saying, okay, maybe let's see what we can relax on May 1st, right? Let's see what we can relax on May 15th, just to give some arbitrary dates. But we need to continue it at least until kind of that time frame of kind of what we're currently doing. And conversely, if we start to see that run up now, even with social distancing, then I think, we need to be prepared for a really, really adverse scenario where our mitigation efforts may not be successful, and we need to just go straight on into like how much capacity can we build in our hospital and, all the stuff, right? The Mercy, turning large public areas into field hospitals like they've done in New York. I mean, if we see a run up in this week, I think we need to be prepared that this is going to be, a very adverse scenario for Los Angeles County. So I think we're right at that crossroads. And I'm comfortable making that prediction. As far as predicting beyond that, this week was about as far as my crystal ball went since the beginning of it. So,
well, you know what? That's all.
Ask me again next week.
That's very clear. And that's again, you started this whole thing by saying, we don't know. So, I mean, there is no crystal ball that'll probably work. But I see what you're saying. My fear is that people are going to chill out. People are going to get real casual because, well, number one, LA is all about social distancing before this fucking thing. like people kind of just sit in their cars, driving around. It's not like, there are parks, people are out hiking and stuff. That's all fine. But it's not like New York where you're jammed on top of each other. It's not like Toronto where it's all jammed on top of each other. You're close quarters. LA is so spread out. So, Shelby and I were both thinking like maybe LA naturally is kind of built for this a little bit better. We're more prepared because we do spend so much time isolating from each other. Like I got friends down here who I've known in Toronto who I didn't never see. It's just, that's just how it is,
Yeah, and I think that could be. I don't think that that's an unreasonable thought. But like all theories, it has to be tested.
Yeah.
And I think this week is the test of that theory. And I personally agree with you. I think we're going to have a different course from New York. But, my day job is to make sure that my hospital is as prepared as it can possibly be for any number of patients from 0 to the worst things that you can think of. And, I think this is a moment. Like we'll see.
Well, I was digging around yesterday in my little crawl space, and I found a couple of and because I was doing some painting a while back, and I found a couple N95s. So if you need, you let me know. I got a couple. I found like a packet. I found a packet from Home Depot, and I have one. Shelby has one. I'm not sure if Baby Mattis would fit because it would cover her entire face. But if you need a couple, you just let me know. I'm here for you.
Well, we may need a couple 100,000 if this whole thing goes down. So if you just have a few more in your crawl space, then you just bring them down to the hospital. But actually, in all seriousness, we do have a donation drive for the hospital, which I should probably pull up on my phone and kind of plug that.
Oh, do it. Plug it.
It is. See where we can get that going.
Is it a financial or is it everything?
So it's really interesting, in that we actually can't accept money because we're a public hospital and there's like a law against government organizations like randomly fundraising.
Yeah.
Probably because someone abused that power.
Mm-hmm.
Once upon a time. But let me see.
But gear is needed. I mean, obviously.
Here we go. The email is medsupply@dhs.lacounty.gov.
Medsupply at DHS. Yeah, go ahead.
Yeah, medsupply@dhs.lacounty.gov.
Yep.
And we'll take basically anything. Bud Light would be great, but we'll take Coors or Miller too. But anything. There's nothing. There's nothing too big or too small. The main thing that we ask is the ideal is to have stuff that's in an unopened package. If it's like your 1 or 2 N95 from whatever home construction project 10 years ago.
Yep.
It's opened, like we can't,
Of course.
Yeah, you can hang on to that, for a rainy day or whatever. And then there's if you want to drop it off, Sean, I'll just send you the map that shows where at each of our DHS facilities you can drop off stuff, and you can literally just roll up. So in the old county, they used to actually have like they had a sort of a pejorative term for this, so they had basically a phone or a buzzer that you could ring, and you'd roll up with your gunshot wounded friend, and then push that individual out of the car and kind of ring the bell and drive away,
and then book it.
So this is kind of that policy of like no questions asked. Like if you bring in 200 N95s that still have our like hospital logo on them, like okay, fine, well at least you brought them back, like thanks.
Right. Nobody's gonna question. Have people been makeshifting protective gear? You guys are not there, right? You guys are prepared enough right now.
We're not there.
But are those real stories? Is that fake news or is that real? People are actually using.
I get it's heartbreaking. So I get every day. I get phone calls from my friends in New York, or from people that I know in New York, or people that don't even know me and got my number from I don't even know how. And it always starts the same. It's like, hey, I know you don't know me, but I'm a doctor at like insert hospital name in the Bronx or in Brooklyn or in Manhattan or whatever. Because I went to medical school in New York, so I have a lot of friends in that area. And like so and so gave me your name. Like, do you have anything? Could you send anything? Like anything? We'll take anything.
Wow.
And it's just really.
What are some of the craziest things that you've heard people are doing? And because. And what are some of the craziest text messages you've been getting,
Oh, the craziest text messages that from a medical side for sure, or it's every time, we have this chain of a bunch of people that I, went to medical school with, and, it's every time someone, has to put another young male on a breathing machine, who's like younger than all of us, and we're just like, oh my God. And it's constant. It's like, oh, I just put another 33-year-old on a breathing machine, or I just did, chest compressions on a, 28-year-old, or, I just saw, an x-ray of a 39-year-old who has, terrible COVID. That's the craziness, that we're seeing. Because I think that, there are some other really austere conditions that are happening at smaller hospitals and at certain sort of random places in New York that you might not always expect. Like, I think it's just that one cluster of patients pops up in like a local ER, and they're just not ready for, to put 5 patients on the breathing machine at the same time. More than, because at the bigger centers, it's more like, well, we just have this unrelenting flow of patients. It's just one every hour comes in. And after 5 days of that, you're just like, what is happening? Like, this is ridiculous.
Yeah.
Um,
But we're not there yet
so
in California. It doesn't seem like we're there in LA County. Not yet. But you say this
yeah,
week.
it's going to be uneven. It's going to be uneven. Like I know one of our other area hospitals, in LA has already been hit pretty hard by this. And the thing is, like, it just doesn't take that much. A few hours of this or a few sort of clusters of patients like this in
That's
your
right.
hospital's area. And it's just, for that time, it can be really overwhelming. But we haven't seen a sustained flow of patients that, you know, like we've seen in New York, thank God. We're definitely nowhere near that point. And our job is to stay ready. So,
Well, listen, neighbor, you're a hero in many people's eyes. Everybody on the front lines are right now probably the most, I mean, they are the most important people on this planet right now because they're the ones that are fighting this thing. They're doing everything they can to take care of people who are coming in. Some of it, they can't do anything, but I know that right now the majority of people listening to this are probably going to be in Canada. So I don't know if anybody in New Brunswick can drive some gear down and drop it off at the hospital. But I just know that I think people hearing your story and hearing what you guys are just fighting for every day is really heartening. And thank you, man. Thank you, and thank you to your wife, and thank you to everybody at your hospital. And I could end up there. Anybody could end up there.
yeah.
But this is
Yeah.
the new
And,
world we
I
live in.
just want to, this is the new world. Welcome to a new world. I just want to say that I think we do need a little bit of a collectivist sort of World War II mentality about this. Of there is something you can do, and it's like as in many issues where we need shared sacrifice from a national level over a long period of time. The things that we can all do every day aren't always the things that we want to do, and they're frankly fairly unpleasant. But that doesn't make them any less necessary, and it doesn't, you're by following the guidelines and listening to people and doing the right thing, like you are helping us. Like that's what, thank God, has given us the last month of being able to get prepared. And we're using that time that you guys are giving us. And it's really, really important to have that sense that we can't do this without you. If the social distancing had not worked and we had turned into New York situation a month ago, they're not bad people or bad doctors or a bad healthcare system per se. I don't know that anyone can handle this that has seen that level of surge. So, we are in this together. There is something that people can do. You should not feel powerless. Your role in this is to
Stay home,
not spread this disease.
Yeah.
And you can do it. And we need you to do it more than ever.
But it must be so,
it's like,
it's so hard right now when you think about, first of all, yes, of course. And I think that is important for everybody out there to understand that what you're doing by staying home, it is an inconvenience, especially if your husband or wife is super annoying. Mine is amazing, so I'm lucky that way. But I think a lot of people, especially in America, dude, I'm not going to lie to you, but there's this whole thing of civil rights and you can't tell me what to do. This is my freedom. There's that thing that's burned into people. And then also with, the current administration, I'm not getting political, but I am there is a world of misinformation out there. And there's a world of, look at how many times the message has changed in the last month in terms of this is nothing. It's going to go away. It's just like the flu. To just yesterday, it's like, you know what? If we get 100, 200,000 people, we're doing our job. We're doing a really good job because we saved 2 million people. You know what I mean? So in that world, it's so important to hear it from you where you're saying, no, all politics, all fake news, all that bullshit aside, it's working. It helps. We need to continue.
Yeah, I'll close with, so I go down every Tuesday, and me and one of the other guys in facilities operations, the director of facilities, we go down, and we talk to all the environmental services workers at every shift. So we go down at 7 and at 3 and at 11. And it's a hard thing to do. It's a big group of people, and frankly, if there's a group of people who have had tough relations with some of the medical and nursing staff over the time, it's for sure something that we've seen. And I was talking to one of the guys, and he asked me a really nice question. He comes up to me and he says, so how many people in this particular clinical area where he works, like how many people in that area have gotten sick, right? And I was like, what do you mean? And he's like, well, I want to know because I clean that area, and it's my job to keep these people healthy, and I want to know my score. I want to know if I'm doing the right thing. And I was just like, man, hats off to you. I mean,
that's amazing.
That's just the absolute truth. Like there's so many people beyond the doctors and nurses who are all, are all rightfully incredible people. But there's so many people who protect us and who allow us to do our jobs. And I think there's a lot of different ways that we're from a truck driver to, heck, just somebody who, is doing road maintenance and allows us to get to work. I mean, this is a system, and we're maybe at the tip of that spear at this moment, but there's a lot of components to that, and we value, really, really value every part of that. So whatever role you're finding yourself in this, thank you to you.
That's amazing. That's a great story, and he is a hero as well. This guy who cleans that area, one particular area, he's taking ownership of it. Well, listen, Dr. Dan, if you don't mind me calling you Dr. Dan and not just neighbor. Hey, neighbor. Thank you, man, for your time. I really appreciate it. I know you're insanely busy, but I'll be seeing you out front with your dog. Oh, are dogs? Can they spread it to each other? Just so I know, because sometimes
not as far as we know. Not at this time.
Not at this time, but that could change. Anything could change.
Yeah. So there is long story short, there is a version of the coronavirus that dogs can get, but so far as we believe, this current human version is not transmissible to dogs, so far as we can tell.
So if Freddie runs over to Max and Freddie have a little jostle, that's okay.
Yeah, it's okay. It's only concerning when the humans get close enough to spread droplets or,
Okay. Well, it's not okay then. We're not going to do it. Not until we know.
Yeah, exactly. It's hard,
listen,
man. It's hard.
I know all of it. But
yeah.
But let's just hunker down and keep at it. So thank you so much, buddy.
Yeah.
We appreciate it, and it's been very insightful. And I hope. Is there anything that people can do in terms of like follow you on? Do you have the Twitter box? Do you care about all that stuff? Is there anything?
Yeah, sure. So I'm I'm on the Twitters. It's DDONOHO. So no one's gonna be able to spell that.
Yeah.
Because I can barely spell it.
I got the spelling.
And yeah, that's probably if you want to hear my musings, that's where you can tune into. The other, there's a few other sort of medical voices out there that I'll usually retweet or you can find, and that's the best advice I can kind of give people is you are the guardian and the steward of the information that you're receiving, and if you aren't seeking out high quality information, there's a lot of rabbit holes down there. So, make sure that your news is coming from good sources that are, thoughtful and, high quality.
Thank you, man. Well, listen, I'll be seeing you outside, and take care and be safe and be everything. Just be you.
You got it.
That's my knowledge. That's my message to you. Don't stop being
all
you.
I can do.
All right, Doc
All
Dan.
right,
All right. Take care.
Yeah.
Have a good day. We'll talk soon. Be safe.
Bye.
Cheers.
See you. Bye.
Wow. Folks, see? I've learned a little something today. I've learned a little bit, reinforcing what perhaps I've been a little casual about, but it's true. It's true. It is making a huge difference. And in the days, every day that goes on, the more this thing becomes a deeper reality that our everyday activity and our everyday behavior has got to change for this thing to kind of take a turn, And hearing that from Dr. Dan next door. has been incredibly insightful. This has been a good episode. This is a good chat. Again, another random. I wasn't expecting to, there's no lining up. My PR guy didn't call my neighbor and say, hey, we're looking for a medical professional to have a conversation with about blah, 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 blah. So, listen, there it is. It's, again, at DDONOHO, Donoho, D. Donoho. Follow him on the old Twitter box. Of course, you can follow me at Sean Majumder. And thank you for listening. I think we're just going to wrap it up. It was a good one. Please share this with many people because I think this is a good educational one that everybody needs to listen to. It doesn't matter if it's Canada or U.S. or wherever you're listening to this. It's important to hear it. So thank you, guys. Thank you so much. Who knows what's coming next? But in terms of this podcast, but I'm loving it. I'm loving the interviews. I'm loving this thing. If you guys like this idea, please send me some feedback on the old Twitter, on the old Instagram. I'm at Sean Majumder. Subscribe to this, but also remember to subscribe to at The Movie Womb. That's Jazzy, by the way. She's been sitting next to me this whole time.